I also want to share with you, and we will start. We'll have the agenda also put in the chat box. Please feel free to come with your questions and comments in the chat box, and we will try also from our side to answer and administrate that as best as possible. And it would also be good if you can present yourself in the chat box, please, because we will not have time to, as we are so many, to do introductions. And I always regret that at this webinar. So would like to share with you that we have decided to also do a webinar on an induction webinar on PMNCH and an updated one on our, not only our strategy, current strategy, but a little history as well as the governance reform, which is really a game changer in the way that we are going to conduct and engage with partners moving forward. So that will be a separate one. The intent of this webinar is very much to share with you the work plan and what has gone into developing the draft and the process onwards to its review and approval by the executive committee. So we have then put together a slide deck for you, which I'm going to get help from Julia to share. Thank you, Julia, for that. And before I start, I just want to remind colleagues here that all 10 constituencies, from private sector to the healthcare professional associations to adolescent youth organizations, are represented during this webinar. So I'm very pleased that we have a cross-section of all constituencies, as well as members from our working groups, as well as our committees. So having said that, we shall then start. Next slide. So I just want to share with you that we had at the board meeting last year, which is December, the board meeting was to discuss, and you will recall that the intent, the new terms of reference of the board as a result of the governance reform is to guide on the strategic direction as it relates to women, children, and adolescent health and its priority, as well as position PMNCH given its added value, as well as oversee the executive committee. So in preparation for the board meeting, we worked, the secretary worked very closely with the constituencies, as well as the working groups and the committees. And there was also a survey of all members identifying advocacy priorities. So the request was, what should PMNCH's advocacy priorities be in 2022 and beyond, given our 5-year strategy? And we will then share with you the link to the strategy in the chat box, so that's easy for you to have access to. We also then, the board, this was all summarized and by the co-chair Anne Stars of the Strategic Advocacy Committee, who then presented this at the board together with the results of the survey. And there were several breakout sessions of among the board members, and so the board deliberated on priority. The board discussed the what of the strategic priorities for our advocacy, as well as looking at the how, which was more how can we position ourselves in order to really deliver on our added value. So the results of the board decision, which will then guide our implementation and our operational plan and work plan, is what you have in front of you. There's more of a detail related to this, and that's available on our website, and you can access that, and the link to that will be also put in the chat box. So to summarize, we have then the board agreed that the COVID call for action, the PMNCH COVID call for action, is still relevant, and the most irrelevant asks that we have to administer and continue focusing on is ask number 1, to enhance and protect access to PMNCH services, including mental health. Ask number 2 was SRHR and gender. Ask 3 was quality and respectful care, including midwifery. And then the board also agreed on the need for greater focus on health workforce, which was asked for, and the prevention of violence against women, children, adolescents, which is ask 7. So they also agreed that the increased focus on women, children, adolescent health is important, including SRHR in the universal health and PHC, improving equity, resilience, and recovery. And this was very much a recognition that the countries that are struggling with vaccine uptake are indeed countries with weak health systems. And so one needs to see how these two can be correlated and related and addressed together. The third bullet point is increase on adolescent well-being. The board did decide that the next Partners Forum should be focused on the global advocacy and the global adolescent forum, and will be at the third quarter of 2023. So that was, and it also highlighted that there was a need for a greater focus on mental health, adolescent mental health, greater attention on the connection between SRHR and adolescent, including school health, CSE, and a greater focus on the impact of climate change on adolescents as well as on women and children. The last point that the board cited was to focus on ending preventable maternal, newborn, and child deaths and stillbirths, including positive focus on optimizing care for MNCH and well-being. Linking this effort to our work on the COVID call to action and increasing attention to midwifery gain and quality care, including respectful care. So this was the direction of the minister. Next slide. May I please ask you to mute? Thank you. And so I just want to remind members that our theory of change has been updated in order to be fine-tuned with the outputs that have been then decided or suggested. So PMNCH's member designed and implemented PMNCH branded advocacy related products, events, and processes. And this will then lead to short-term outcomes, which is the PMNCH members' knowledge and skills, networks, and engagement increased and strengthened by the outputs, and then which will then lead to the intermediate outcomes, engaging and capacitating PMNCH members to influence policymakers to make new policies, financing, and service delivery commitments. And some of those service delivery commitments must focus on empowerment and also self-care, care-seeking behavior. This was then done by the facilitating that new policy, financing, or service commitments. PMNCH will contribute to the high-level outcomes of improved national policies on MNCH, SRHR, and adolescent well-being, improve country health expenditure per capita for these focus areas, improve coverage and quality of essential services, and uptake for these for these priority areas. And these will, of course, result in towards the impact of the SDGs, and also the global strategy for women, children, adolescent health. So, next slide. We've developed the results framework, which we will then now need help in agreeing on indicators and also deliverables, and to understand how the PMNCH success ladder will look like. So the results framework guides work on the PMNCH members and the Secretariat during the strategy period, 5-year period. It informs external stakeholders, including current and potential funders, about the work and the value add and results of PMNCH. And it will also provide the basis of a monitoring protocol for our external evaluation in 2024, which will be for the entire strategic period. So what we have done is, this is what results looks like for PMNCH. We will need to get a little help from yourself, from the various constituencies, in understanding what our outputs and our outcomes will look like, and how they shall be measured, because then we will actually put activities in place in order to measure some of what we're saying we will do and what it will lead to. Next slide. So the development of the 22-23 work plan was very much the development of the work plan has been led by the standing committees and the working groups, supported by the Secretariat. We have then taken really what we were doing in the first year of the strategy period, and we have then also looked at what the board priorities are. We then put this together in a zero draft work plan and understood what logically the various deliverables could then be. And then this went to first to the EC meeting, because the EC needed to provide guidance. And the executive committee had a meeting on the 20th of January to provide guidance on the way forward with operationalizing the strategy, strategic directions and decisions made by the board. So then we worked further with yourselves in working groups or committees in then preparing for a retreat that was conducted on the 1st and the 2nd of February, which were then further deliberated the content of these deliverables, if you will. And they will then be aligned to our 3 areas of function, as you will remember from the strategy, which is knowledge synthesis, partner engagement, and campaign and outreach. So this will very much then need to be delineated how these 3 will work together in order to then really contribute effectively towards the results framework, which I've just shown you. So next slide. So this is really just a reminder that the board approved an essential level and the executive committee approved an essential level of 10 million in budget and a comprehensive budget level in 15 million. I can just share with you that for 2022, we have only on account 5.2 million. So we are an additional 2.6 million that has been identified as possible pledges. So we are still in shortfall of the budget for this year. So this is something we have with you. You will also be reminded that you also remember that our PMNCH contribution is core implementation and coordination, which includes PMNCH Secretariat staff, coordinating and facilitating, and so forth. And then additional investments, which can be in the form of travel, can be in the form of grants, and it can be in the form of areas that we want to fund, which has been decided then by the committees and the working groups. And then, of course, the overhead, because we are hosted by WHO, we are similar to all of the other departments in WHO, then required to actually have 13%, which is for overheads program costs. So that is how our budget is comprised, and we have then now set up and tried to sum up some tentatively what these sums will be according to the three functional areas, and have come up with the 10 million for the 2022 and the 2023 15 million, which we are hoping, especially because the global forum, the partners forum, will take place during that year. I will, however, go in more in depth now, and so that is next slide. So the next slide, this there's 3 pages of our work plan. This page is about knowledge synthesis, which, as you will recall, the intent here is for us to synthesize knowledge as it pertains to maternal newborn child health, SRHR, adolescent well-being, so that we synthesize knowledge that we need in our advocacy in order to influence change. And what has been then decided here by the process that I have described to you is that 1.1 is the economic analysis, which puts together the analysis of the analysis that has been done by partners and looks at gaps, and also looks at ways of how this can be more powerfully communicated and put together as a resource compendium for our partners to use at their leisure and at their time and their need, but also for us to use it together to get 1.2 is about the UHC and PHC compendium that WHO has developed, and the idea here is to make it a guidance note related to planning for SRMNCAH, and to see this in the context of the compendium that we have developed and are continuing to maintain on the COVID response and preparedness plans. The third is the accountability work, which is very much the progress reports that we have pledged to develop on a regular basis with our partners and amplify the trends and at any given time, but also make available resources of accountability for our partners to use, to know about and use for their own accountability and advocacy. The fourth is we have been, it has been an importance to really highlight also women's voices and lived experiences. And so there has been now a line for this, a deliverable on this, so that we amplify what women want, what they need, and so forth within our women, adolescent, and children's group. 1.5 is really our priority areas, and here there will be an opportunity to highlight really the gaps or the needs of emphasis related to MNCH and SRHR, as well as the adolescent health. The adolescent health and well-being has identified, as you know, the BMJ series on making more clear the adolescent well-being framework. I just want to pause here a little and bring to your attention the various columns. So the next column, and then from the description of each of the flagship programs here, is really the coordinating structure. So for 1.1, 1.2, 1.4, and 1.5, the Knowledge Evidence Working Group has been identified as the coordinating structure in our governance structure. They will be responsible to oversee, and what that will mean is they will oversee this development, but also the linking these knowledge synthesis to partner engagement and also out campaigns and outreach towards the other structures in PMNCH, which are, as you will recall, the Strategic Advocacy Committee, the Governance Ethics Committee, and also the working groups, the Knowledge Evidence Working Group, as well as the Accountability Working Group. So here is the knowledge evidence will be in lead of this. 1.3 is identified to be the accountability working group, which leads then those products that are within this area. The knowledge evidence working group has very much organized themselves according to work streams, one being economic analysis and financing, the other is MNCH, SRHR, and the fourth, adolescent well-being. And so there is an opportunity, and these structures are open. If you want to be a member of these and in any of these areas, then please let us know, and we will then inform them of that, and you can then engage in that way. The hope in the future is that our digital advocacy hubs will cut across all of our committees and working groups and facilitate a better engagement as it relates on focus areas. So this I will come back to, this I will come soon to, and in the next slide. But just to note that we are looking at ways of how better to engage across the committees and working groups, as well as engaging the constituencies. So the next slide it covers the partner engagement, and partner engagement is the intent of partner engagement is to capacitate all of our partners and members, at the same time also strengthen the coalitions so that we can come together more powerfully and do more together than alone. And so that's really the objective of all of this area of work. So the first is the Global Leaders Network that is at the highest state level. This is the president's, it is envisaged to have 10 presidents. Our board chair will be a facilitator of this group. And I'm pleased to share with you that President Cyril Ramaphosa has agreed to chair this group. And it is currently in the establishment phase. Second, 2.2 is about strengthening national coalitions and multi-stakeholder platforms and support constituencies and partners to mobilize and implement commitments. This can be what we had in the past as multi-stakeholder platforms, looking at the small grants, looking at how to engage constituency at the country level more powerfully together. It can also include the parliamentary engagement strategy and so forth. So this is very much about strengthening coalitions and also strengthening the country engagement in a meaningful way. 2.3 is constituency and partner capacity building for enhanced advocacy through purpose-built learning. This can be webinars, workshops, professional development programs, etc.
This is question I have here from the chat from Bill Jeffrey. We have to ask the task force actually if they would.
Okay, I don't think that question was to me, but please, if I can ask you to hold your questions, and I will take them, and we will can go also back on the slides. 2.4 is about creating the PMNCH digital advocacy hubs, which was at the heart of the governance reform paper that was board approved in the December 2020. to support partner engagement and knowledge sharing, capacity building, and joint action. And this is something that's still in the making. The timeline on this is perceived to be somewhere at the end of March, where we hope to have the digital advocacy hub on PMNCH, SRHR, as well as the adolescent, as well as in 3 countries. So what we were trying to see here is ways of engaging together that we have not been able to, because we are so many and we're so different and we're so in so many countries. And so we need to find digital mechanisms that really enable us to engage more powerfully together. 2.5 is really the inclusive participation of partners, and it's really about the continuing implementation of our governance reform, including our work on really good governance, including our work on implementing the meaningful engagement of youth engagement in our work, and so forth. So that's very much the intent of that. And as you will see on this slide, and I would like to bring your attention to it, if you see the coordinating structure, the idea of the 2.1, because it's so much, it's at global, but it's at country, it's a shared coordination between this strategic advocacy committee and the PEC, which is the partner engagement in country committee. 2.2 is very much PEC. 2.3 is a joint, really capacitating the individual partners. So therefore we saw this as being a joint venture between PEC and Knowledge Evidence Working Group, as well as the Accountability Working Group. 2.4 and 2.5 will be coordinated by the Governance Ethics Committee, who is also in charge of the overall nomination and selection process within our governance structure, as well as they will be doing an assessment light of the governance reform later this year. That is what they're responsible for. Next slide. That is the campaign and outreach. This is just to remind partners that this has to do with really how do we capacitate or facilitate advocacy and amplification of messaging in PMNCH. And this we do through events, through campaign efforts of mobilizing commitments, as well as our media products. So 3.1 is our global forum for adolescent on adolescence event in 2023. 3.2 is the PMNCH led events, which usually happen around the World Health Assembly, the high-level political forum in July, and our accountability breakfast, and usually the Sunday right before the UN General Assembly events. And then in addition, we have many partners that have events that we collaborate with, and that's 3.3. That describes those that we engage in and support support our partners. 3.4 is mobilizing and the efforts that are associated with really mobilizing and dialoguing with countries in order to get commitments and also their follow-up, which is a host of activities and a strategy in itself. 3.5 is the digital and earned media products. And this is all of our really blogs, our podcasts, our op-eds and everything. So that is very much captured in there. Again, I'd like to bring your attention to the column that identifies the structure, the lead structure, and that is very much the strategic advocacy committee. For 3.1, 3.2 will be the accountability working group, and the remainder is very much strategic advocacy committee. However, the strategic advocacy committee has been very diligent in including all of the other structures, because this is not done in silo by different committees. This is only as good as it is actually woven in and coordinated together, so that knowledge synthesis, partner engagement, capacity building, and also events and media product and mobilization and campaigns are all actually done simultaneously in an orchestrated fashion. So this is really describes then what is intended in the work plan for 2022 and 23. And as you will see, that the majority of the budget for this area is campaigns and outreach and partner engagement, and then less on knowledge synthesis. I will move to the next slide. So it is really important that we not only agree what success looks like and we strive to reach it, but we need to then understand what the measures are, what is being monitored and measured, and what will be the approach to the measurement. So here for intermediate outcomes, it will be number of commitments, it will be a number of global regional commitments, and these approaches will then be not only tallying commitments, but also their value as it relates to policy, or as it relates to financing, or as it relates to service delivery coverage outcomes. So short-term outcomes is really increased knowledge for advocacy, increased advocacy skills and networks, increased advocacy campaigns and participation. So we will be monitoring outreach and the numbers that we're reaching, but also to seeing what does this actually result in. Monitoring and measuring will be outcomes to an individual organization, with work in the two phases. Phase one with focus on setting up a set of baseline to measure against, and phase two in 18 or 24 months we'll see a review of whether there has been any progress against these baselines as a result of PMNCH's work. The outputs are more evidence products synthesized and or developed, coalition strengthened, partners capacities built, and advocacy campaigns organized and delivered. And these will of course be then the approach for measuring these will for different types of indicators for each of these categories as then follows. Type 1 will articulate major developments like the Global Leaders Network established, or type 2 will be number of products, events and processes. So number of products developed, processes completed. Type 3 will be people reached and or engaged. So 2 billion were reached through our social and earned media. A video may have been viewed by 115 million people, and so forth. And then the fourth type is more the qualitative indicators or partners supporting global advocacy, adolescent forum, for example, or how it is described, how we were helpful in maybe establishing policy change, or our partners were with partners influenced a change in some way. Deliverables can be all the deliverables and sub-deliverables listed in the work plan, as I then have gone through. And so it has been decided by the EC that we shall provide a progress report every 6 months, and that the progress report shall be aligned, or shall be, of course, using our work plan, and to that work plan provide two columns, one for the 6-month mark and the other for the 12th-month mark, where we then highlight the progress of each product. So green meaning that the deliverable is completed, yellow is that it started but it's currently on track. Orange is that it's in progress, but there are some risks, and we have and these risks are now being mitigated in some way. And red means that it has been stopped. It has been decided to not continue with that product for various reasons. And then usually what has happened then is that there is a recommendation for what else to do instead. Next slide. So the next steps here is for the consultations and dialogue that we are embarking on. The draft 2022-23 work plan and budget will be shared with the executive committee and in turn the broader constituency members for their dialogue and consultations. So all webinar is today. Introducing the work plan and budgets with an opportunity to ask questions, and we can then try to provide answers. The next will be the constituency consultations to be held in advance of the EC meeting from the 7th to the 14th of February, but this can go on up to the 21st of February, for then the constituencies to develop answers to prepare themselves for their representative to then meet in the EC to then discuss the work plan, review it, and then approve it. So the next steps after the EC approval of the work plan, which will be then after the 22nd of February and into March, will be that the terms of reference for the coordinators, the column that I was talking about, and support functions of committees as related to each deliverable will be developed and agreed with each of the committees or working groups. Each committee will then take and develop a 1 to 2 pager delineating the sub components of each of the lines that I've just gone through with you. And they will identify products, budgets, partners, including partner leads, and then budget per sub deliverable and timelines. So that's what will happen after the EC. And then we come at mid-term, mid-year, we will then be asked to check in with progress, traffic lights, including budgetary availability, and align and get really a feedback on where we are in implementation at the EC. And this will most probably happen at the EC meeting that is set for the 9th of June. Next slide. So I think this is the last slide, maybe, or close to the next slide. Last slide. This is just shows you a little bit the product, where we are. I have already highlighted, where we came from with the board decisions to the EC in 20th of January, and then to the retreat in 1st and 2nd of February. Then we will go to the deliberations in the constituencies, and then the approval in the board in the EC on the 22nd of February. Next slide. And this is more a delineated in detail overview of what I have then described. You will see that it describes each stage. Julia, is there a next slide? So what each of the constituencies will now deliberate is really, and you will remember that we have 10 different constituencies, so they will deliberate one, their impression of the draft work plan, their reflections to it, and then a little very much focusing on their added value of what they can contribute that is unique to the constituency. And this we will need to also capture and get from each of you in your constituencies towards the results framework. An example of this is how many universities or research institutions can we then work with and get amplify this knowledge synthesis? How can it be used, and how can they be partake in really contributing to policy change? So somewhere in that thinking, we will need each of your help in developing, in articulating, so that our results framework can also be filled with the targets and indicators that we are looking for. So that is one. The other thing that they will also deliberate is who is working on specific things that they can put their hands up to and get engaged in the various work streams that will then be facilitated by the digital advocacy hubs at a point. And how can we build on the work of our partners to amplify the messages that we want in order to drive change? Then lastly, we will ask each constituency, what is it that they need from the Secretariat in order to enable them to really engage better together and to really deliver PMNCH's strategy and results framework. So that is really a snapshot of where we are in our planning. It's extremely very exciting, but we need to understand from you also what is it that you need of information, and what is it that we can provide that makes it clearer and more effective in this engagement. And we have tried to update our website so that the areas of engagement and the areas will be updated regularly to provide information. So let me stop there and let me give you the opportunity of asking questions. And so over to you. And we will try to, the questions that come in the chat box, if I see them, I will answer them too, or if not, I will get help from my colleagues in the Secretariat to answer them directly in the chat box too. Okay, let me stop there and then just open it up for any questions. So Ahmed, please, may I call on you because I see your hand? Ahmed, you are on mute. You need to demute.
Thank you, so kind of you. This is Ahmed from Pakistan. It's great opportunity to on this webinar from Pakistan with you. I need to tell you about something Pakistan, that we are working with you since 2010, but we are not getting some opportunities from your side to be partner with you in Pakistan. So this is something that we feel, our organization feel, that we are partner with you since 2010, but we don't have any opportunity to work with our community, with work you, but you have so many funds to utilize. Why this is that we don't have any kind of opportunity here for Pakistan?
So Ahmed, I would say that you have a lot of opportunities now. It's especially with the new strategy and the work plan. What I would like you to do, what I would please encourage you to do is send us your email, and we will get back to you and provide concrete suggestions of how you can get engaged, better understanding a little bit on your organization and what it is that you'd like and mean that you can contribute with, and how it can benefit yourselves too.
Yes, we, the NCVP Pakistan, is working here with so many UN agencies here, American Refugees, CRS, and so many other organizations we are working here. And you know very well the situation of Pakistan. Every Afghan refugees committees, Afghan refugees are also Majreens are here coming Pakistan, and the other Bangladesh is also coming here, and the Indian from coming here, and the Syria is also approaching Pakistan. So that's why we have so many marginalized and vulnerable male, female, and children. So here in Pakistan, we don't have that much opportunity. After COVID, the businesses and economy situation is very worst here, and the per capita income is very low here. No one can buy medicine, no one can approach hospitals, no one can go hospitals. So how we will work with them, how we will support the community if the donors are not coming here, if the donors are not supporting us? So this is worst situation for community, and we are on ground. We are the first one that we can help them. We know about our situation and our ground realities. Worldwide, everyone knows about the Pakistan situation right now. 5 million, more than 5 million refugees came here from Afghanistan in the recent situation. So we need help from your side. So in every kind of cash in kind, and everything, we welcome here to work with them. If you need the profile, if you need the ground realities, I will send it to you. I know the geographical conditions here in Balochistan. Balochistan is, very poorest region here that we are working. So per capita income is, uh, not more than $1 per day. So if a person is getting $1 per day, so how they can buy medicine, how they can, feed their families, and the family size is more than 10 family, every family size is more than 10. So this is not the situation that what situation is here in Pakistan. We appeal.
So Ahmed, I understand, and I think you must remember that PMNCH is not a funding agency, so it will, we are an advocacy, we are an advocacy agency that amplifies a lot of issues. So we will see what our advocacy can be used, and really highlight areas of that. So I think we will follow up. Please provide your email in the chat box, and then we will follow up directly with you. Now, Lola, can I go to you? Lola, you're on mute.
Thank you. I apologize. Thank you very much, Helga. It was really very refreshing to listen to you and to go through the new governance structure, the new approach, what PMNCH is going to be doing in the next few years. And I must congratulate the board, you and your team, for the visionary pose. I also want to put on record that we've had very positive support from you and from PMNCH, even as an organization. And then we often call on PMNCH to support us with advocacy, and that's been very productive in the past. What I'd like to ask is the section on partner engagement. Oftentimes, civil society coalitions on the country level or at regional level are not partners, in quote and unquote. And as we elaborate that partnership, how do we ensure that it's really partners at the country level can benefit and tap into the resources that you can provide for partners at country level? And so the definition of partnership, the expansion of partnership, I did some clarity on that. The second question I'd like to ask is as we define the partnerships, what is the expectation of the partner at the country level to what do we bring into the PMNCH? Very often we sit down here and think PMNCH must bring to us, but we must also look for how we bring to the PMNCH the value and the capacity of our work. How do we, is it through the partnership engagement committees? Is it through it's very difficult as CSO through governments. I mean, what kind of access we have to bring into that work? And I must empathize with my colleague from Pakistan as to the challenges with resource mobilization at country level, as I empathize with the PMNCH to say it's not a funding agent. So there's a communication of that, because in Nigeria we have a PMNCH national. And that PMNCH national, if you don't belong to the PMNCH national, you're kind of lost to PMNCH. So is there some country coordinating structure or country coordinating process that allows us to work with the PMNCH? It's really not clear from the presentation how we can add value and value can be added to us, and what mechanisms there are able to do that. Thank you so much for the work you all do. And
thank you for that, Lola. They were really good questions. I think, to say that the partner engagement coordinating committee is actually working with all of the issues that you have highlighted. They're working on ways of how can we how can we better mobilize for commitments? I mean, what is a commitment? What is the definition of a commitment? What is a better area of following up commitments and what are needed? And how can we engage our partners to play a major role here? Because PMNCH is a global advocacy, but it wants to make a change at country level. And this is the only way to do that is through our partners who are already at country level, and to use them in an effective way and to add value. And I think one of the areas that was highlighted by the country engagement working group in the past strategy was very much that make sure that the small grants of PMNCH are used in order to facilitate that civil society and others that are not usually around the table are given a seat at the table, and facilitate that kind of pressure or coordination mechanism in order to do that. And so they are working on ways on what would be meaningful. And I think this will only be possible to do with partners at the ground, partners in countries, and will be different from one country to another. So I think they are in really grappling with that right now. That's one thing, but I do think that several of our members have articulated that what is useful to them is also getting easy access to global goods. This can be knowledge synthesis, it can be progress reports, it can be lack of progress, it can be, so how can they get easy access of that in order to actually then capacitate themselves and use that for accountability or advocacy. But sometimes, that's not enough. So you need to be pressured. You need to use pressure with more partners, and the more pressure. So we're looking at civil society, citizen hearings. We're looking at, parliamentarian hearings. We're looking at media outreach, and what we have seen is that doing this in orchestration, so that not one of these things happened at this alone, but many things happen in orchestration, is much more powerful influence to change. So they're looking a little bit at those efforts, and I think, and you will have maybe noticed that it receives one of the highest budgets of all, and that is because we want that kind of change. We want that kind of change, but recognizing that we have to, and there was another question in the chat box that I will weave in the answer to here, is it is very much looked in how can we build on the UHC PHC platforms, the GFF platforms, and the GAP efforts, so that we don't duplicate. But on the other hand, we want to actually see how we can build on them, but we want to see how all of these deliver for women, children, and adolescent health. Because if women, children, and adolescent is not made explicit, it gets sidelined. It just does not get addressed. So I think this is where PMNCH can really it can play a role and needs to. But this is happening in the various working groups and committees, and will be delineated in those in the products, if you will, Lola. So I think also our engagement page on our website starts describing a little where what is happening, and so therefore one can get engaged. And I think that with the Digital Advocacy Hub, I'm envisaging that that's going to be much more meaningful to each one of you, because then you can see how it relates to each other. Okay, I'm going to go onwards to Princess Christina. Is that?
Hi, good morning. Well, I'm here. It's morning here in the US. How are you, everyone? Thank you for having me here. This is my first time joining this organization. I'm so happy to be a part of it. I'm actually representing Enlightened Christian Gathering, the organization that's currently in Malawi, and we have other branches throughout the globe, as well as the United States. So I actually went on a church missionary trip a few months ago to Malawi, and I saw there that a lot of the OBGYN clinics and pediatric clinics, they were lacking in a lot of sanitary napkins, a lot of medical help and screening and so forth. So that's why I joined this platform, to see how I can bring more awareness of what's going on in these countries, and also to see how, once again, how we can have access to funding or to build it. Because right now I'm also associated with the Baylor College of Medicine, and we decided to do missionary trips to help in screening for the maternal, the children, the mothers, the babies, the children, and so forth, and bring more awareness to the situations that are going on down there. Even now, they're currently experiencing a flooding from Cyclone Anna, and we're currently now lending support, going down there to bring medical supplies and so forth. So I'm glad that I'm a part of this, and unfortunately, our president couldn't be on today, but he'll be on our next meeting. But I just want to say thank you. I'm just excited. Thank you for having me here. And I hope to bring more awareness, and I will look at the work plans and see what activities that I can bring forth, and submit the work plans and a progress to you guys, if that's possible.
Thank you for that. And I must just tell you that PMNCH, as you know, is complicated. It's complicated to understand because we're so many different constituencies, we're so many different, focus areas where functions are various, and so it becomes multidimensional. But if you get involved in some of the working groups and work streams, and also as our work on commitment mobilization per country, it's going to be much more obvious what and how you can get engaged and really help in amplifying what we need to amplify. What per country, what should those commitments look like at country? How can we follow them up? How, is it constituencies, donors needed to align better together in order to maximize? Is it domestic resources that need to be prioritized more? All of those issues are key, but they're going to be looking a little different from one country to another. So our advocacy has to reflect that, and our advocacy at regional level and global level have to be amplifying that, because the realities are on the ground. So that's what we're trying to help and amplify and influence. So I think we're going to really try to do that in some way. But I think, please, we're going to try to, use digital means in order to connect with you more effectively, and also share the information that you need at any given time. Because what COVID has shown us is that we do have to function virtually, which is going to continue, and not necessarily only because of COVID, but we also have to be respectful for time zones and also regional effort. So these are things that really the board decided in our new strategy. So that's reflected there.
Okay, thank you.
So is there any, I can't see any other hands. Is that, it's yours, it's still your hand, but okay, but
I'm sorry.
no problem. So thank you for participating, and I hope we were able to both answer your questions and give you really an encouraging call for getting engaged and with this new and work plan for 2022 and 23.